Autotransplant in myeloma is here to stay. However, the procedure keeps on being refined. I think induction regimens are being further improved. I think the triplet regimens are well established, combination of proteasome inhibitor plus an IMiD. But now more and more, I think second generation proteasome inhibitors are being investigated. And of course, we may be moving to quadruplet, adding, antibodies like anti-CD38. So the induction phase is being further refined and improved. There has been some debate about the conditioning, about the intensive chemotherapy, why not using two alkylating agents, however you may increase toxicities. I think the hot topic is about the post-transplant therapy, whether you need or not consolidation. According to the European Myeloma Network data, definitely you need consolidation. According to North American data, namely the Stamina trial, consolidation may not be necessary to all patients. But irrespective of consolidation, I think there is now a clear agreement about the need for maintenance therapy. Of course, we still don't know what is the exact duration of maintenance therapy, whether you should use it for a fixed duration, like let's say 2 years, or whether it should go until progression. But again, even this topic of maintenance is a moving target because we've been mainly talking about a single drug for maintenance, especially lenalidomide, which is approved now. But now we are having the combination of an IMiD plus an antibody or plus an oral proteasome inhibitor. So really very exciting feature, very exciting era for the next few years.